Welcome to the 2016 Annual Meeting of the American Academy of Neurology in Vancouver, British Columbia, Canada. This is the world's largest gathering of neurologists with more than 11,000 attendees who are here to learn the latest scientific research advances in brain disease. Follow us at #AANAM. My name is Andy Imholt, and I'll be moderating today's press conference. We're joined by members of the press in attendance at the annual meeting and by conference call. Today we welcome Dr. Natalia Rost, Vice Chair of the American Academy of Neurology's Science Committee and the committee responsible for selecting the more than 2,700 scientific presentations accepted for presentation this week at the Academy's annual meeting. Dr. Rost is also the Director of the Acute Stroke Services at Massachusetts General Hospital and the Associate Professor of Neurology at Harvard Medical School. She is a Fellow of the American Academy of Neurology. Dr. Rost will be providing you today with a summary of what she finds to be 3 of the top most significant research advances being presented this week at the annual meeting, and those research presentations you are sure not to miss. Please reserve your questions regarding each research advance until the end of Dr. Rost's summary. We'll take questions first from those in attendance in Vancouver and then from those on the phone. Please remember to identify yourself and your media outlet prior to asking your question. Just a reminder, there is no embargo on the information being shared in this presentation. The first research abstract Dr. Rost will be discussing is related to a new drug being studied for multiple sclerosis. This research will be presented by Dr. Anthony Trabulsi at the Clinical Trials Plenary Session on Wednesday, April 20th. Welcome, Dr. Rost.
Thank you, Andrew. Let me take this opportunity to welcome you all to Vancouver. It's really a pleasure for all of us at the Science Committee to have such a great attention from many of you in the reporting field. With your expertise in medical reporting, you obviously can tell that the science at the American Academy of Neurology is really growing year by year. In fact, this year, as we've been discussing, is perhaps one of the more challenging years to pick just 3 top scientific advances. The reason I picked 3 abstracts that I'm going to be presenting to you today is very simple. Each one of them has a unique feature that either underscores a particular development in each of the disease directions that I'm discussing, or they have emphasis on repurposing of some of the drugs that have been studied in different diseases. This particular abstract highlights the role of acrelizumab in patients with multiple sclerosis as studied within the context of OPERA-1, OPERA-2 studies, phase 3 trials of this particular monoclonal antibody. The reason why this study is important is because it actually underlines one of the newer definitions of disease progression, or rather successes of treatments, called no evidence of disease activity, or NEDA. If you followed the field of multiple sclerosis therapies over the past several decades, you notice that there are multiple medications that are now approved within different countries, and also these medications have different mechanisms of action. Acrelizumab is one of the latest investigational drugs. It's a monoclonal antibody that specifically targets immune cells called B cells, and particularly within those B cells, a specific receptor that's called CD20. When acrelizumab blocks that particular receptor, the B cells ultimately die. It seems to be that this mechanism is specific to what we call immunomodulation in the field of multiple sclerosis, and there have been some successes with acrelizumab in both relapsing remitting multiple sclerosis as well as primary progressive multiple sclerosis. In October of last year, at the European Meeting of Multiple Sclerosis, OPERA-1 and OPERA-2 studies have been presented. The results are actually available and have been published in the multiple online publications. In this particular abstract that has been submitted to the AAN Annual Meeting, the investigators within OPERA-1 and OPERA-2 trials investigate the NEDA, or no evidence of disease activity outcomes. And this is a very intriguing concept. As we know, there are evolving goals of multiple sclerosis treatment, and the farther we go in treatment of multiple sclerosis, the more we want to assure that there is no accumulation of a disease burden in the brains of these patients. NEDA, or no evidence of disease activity, has been defined in the literature as a combination of no clinical relapses, no increase in disability by these patients, and no MRI activity of multiple sclerosis in these cases, including no new lesions or no worsening of the old lesions. So in OPERA-1 and OPERA-2 trials, patients were randomized 1-to-1 to receive either acrelizumab at 600 milligram via intravenous infusion every 24 weeks, or the standard of care with the interferon beta 1A as 3 times per week subcutaneous therapy. And these patients have been followed for 96 weeks, and the results of the no evidence of disease activity, or NEDA, have been compared. Across the board, patients who received acrelizumab had actually demonstrated significant improvement in elements of the no evidence of disease activity, including significant reduction in the number of relapses, significant reduction in confirmed disability progression, decrease in gadolinium-enhancing T1 lesions, which are the markers of the new disease activity in the brain, and also decrease in the new or enlarging T2 lesions, which represent themselves evidence of a chronic or worsening lesions. So as a result of the trial, in evaluating the NEDA as a outcome, the statement is that acrelizumab may potentially have a greater role in managing disease activity in these patients. And in the study, at least over 96 weeks, there's been quite convincing evidence that showed elimination of some of the significant elements of the burden of disease for this patient population.
The second science abstract Dr. Rost will be speaking about addresses the possible new therapy for mild to moderate Alzheimer's disease. This research will be presented by Dr. Ali Riza Altri at the Clinical Trials Plenary Session on Wednesday, April 20th. Dr. Rost?
The reason I picked this abstract is because this actually abstract is taking us to a new generation of modulating the Alzheimer's disease. Abstract number, just for your reference, is 16A578 AAN, and this is also going to be presented on April 20th in the Clinical Trials Plenary. This abstract summarizes the advances in adjunct therapies to current existing standards of cholinesterase inhibitors, such as donepezil, which you're all very well familiar with. In this particular abstract, there is an update on the results of the previously reported phase 2 trial of idaloperdine. This is a 5-HT6 receptor antagonist, which is supposed to modulate serotonergic system in the central nervous system. As you know, in Alzheimer's disease, up until now, cholinesterase inhibitors is a standard of practice for modulating the disease activity in patients with mild to moderate disease severity. In this study, the scientists were maximizing on the potential effects of serotonergic stimulation as a way to potentiate the acetylcholine and glutaminergic stimulation of the CNS, and as a result, hopefully improve and even potentially reverse some of the work in memory deficits. 5-HT6 receptor is one of the serotonergic receptors that has been discovered recently as a group of novel CNS receptors modulating the executive function and memory. And One of the interesting parts of involving serotonergic agents in modulating of disease is that previously 5-HT6 receptors have been implicated in treatment of anxiety, depression, epilepsy, and also obesity. These receptors are almost exclusively confined to the central nervous system, and both agonist and antagonist, which is stimulant and blocking potential of these agents, is actually modulating the disease activity. So in this study, in phase 2 trial, there's been a preliminary testing of the safety and the preliminary efficacy and tolerability of this compound indalaperdine. And they have demonstrated, and the results of the study have been published actually in 2014 in Lancet, that there is a potential potentiating effect of indalaperdine working with the Nepazil in improving of the working memory in the patients. In addition, safety and tolerability has been fairly favorable. There also has been positive effect on the primary endpoint with cognition, as well as the function and clinical global impression instrument measurements that have been taken in this population. In addition to that, there's been a possible report of amelioration of anxiety and hallucinations. At the clinical trial session, Dr. Atri, representing the study, will provide the updates on the current enrollment in the phase 3 study of indalaperdine.
Thank you, Dr. Rost. The third research topic Dr. Rost will be addressing is regarding a clinical trial for Lou Gehrig's disease, or ALS. This poster is presented by Dr. Richard Smith and colleagues. It will be taking place at Poster Session 2 on Sunday, April 17th.
Thank you, Andy. The control number for this abstract is 16A83 AAN, for your reference. We're very excited about this scientific submission to the AAN. Not every day that we can actually report that there is a medication that can show benefit for patients with Lou Gehrig's disease. As you know, this is a severe disease. It's a fatal disease. And at this point, while the researchers are feverishly seeking for disease-specific treatments, what we can do also is to try to modulate the course of disease. One of the debilitating features of Lou Gehrig's disease, or ALS, is involvement of the bulbar function. Bulbar function is usually referred to as a function that's helping modulate the voice, swallowing, and control of the saliva. In these patients, when bulbar function gets affected, it becomes almost invariably a first step toward irreversible disability and frequently a beginning of the fatal complications that lead to aspiration pneumonias, potentially a need for a placement of the feeding tube, and basically downhill worsening of the disease progression. So in this study, a group of researchers sponsored by the ALS Association Treat ALS Award for Pilot Clinical Trials have attempted to address anecdotal reports of dextromethorphan being used for patients with ALS to help improve their speech and swallowing. Dextromethorphan is a combination of the drug you probably heard before called Nuedexta. And Nuedexta is a drug that basically involves dextromethorphan, which is a common cough suppressant that you can see in a medication over the counters, with a metabolic inhibitor called quinidine that allows the levels of dextromethorphan to be rising in the plasma of these patients to sufficient levels. Nuedexta, or dextromethorphan quinidine combination, has been recently approved for treatment of pseudobulbar effect. For those of you who have seen either advertisements on TV or heard stories and testimonials from the patients, patients with pseudobulbar effect are those who are affected with sudden, unprovoked episodes of crying or laughing, which is uncontrollable for them. This is a disturbing condition and frequently seen in patients with ALS, multiple sclerosis, stroke, and dementia. In this study, the researchers used dextromethorphan quinidine combination in 60 subjects, which were treated for 1 month with this medication, and others with placebo in the parallel group. And then after a washout period, they had a crossover, and the other group of the placebo group of patients was treated with dexamethasone-quinidine combination, and the initial treatment group was changed to placebo. The qualities that or outcomes that they have been describing were basically the self-reported bulbar function scale, which is frequently and commonly used in progression of ALS disease. They also did testing for the time speech and swallowing and other measures of the bulbar function in this patient population. The main outcome of the study that the treatment group had a better performance with the swallowing, speech, and control of the saliva as compared to the placebo group. And in this case, the researchers are concluding that the combination of dexamethasone and quinidine may potentially alleviate the bulbar symptoms as part of the palliative care, but may also need to be investigated further with regard to the mechanisms of action of the dexamethasone specifically on the neurons that may be affected during the motor neuron injury.
On behalf of the American Academy of Neurology, I'd like to thank Dr. Rost and members of the media for attending. For more information about the American Academy of Neurology's 68th Annual Meeting, visit AAN.com and follow us at #AANAM. For the American Academy of Neurology, I'm Andy Imholt.